We trust doctors with our lives.
But most Americans are not confident in the U.S. healthcare system as a whole.
A Gallup poll released in 2023 reveals just 1 in 3 Americans have faith in the medical system.
Now some physicians are taking healthcare into their own hands, creating a so-called doctor subscription service.
Reporter Heather Graff has an in-depth look at how it works and whether it's a viable option for families.
Lee and Tisha, as of 2022, the U.S. healthcare system was valued at $4.5 trillion. We spoke with some doctors who argue it puts profits over patients. When it comes to healthcare in America, doctors Chris McCarthy and Jerome Ii put it bluntly.
It's definitely broken, yes. I mean, in most every facet.
It's why they left a traditional hospital setting to open Palmetto Proactive Primary Care in Spartanburg, South Carolina.
That looks great. Let me take a look at this.
Their practice is a model of health care experts say is emerging across the country, known as direct primary care, where patients get premier access to their physician, including same-day appointments and longer visits.
The typical office visit is 7 minutes. My typical office visit minimum is 30. And so patients are surprised when they first come in. They're like, wow.
Dr. Teresa Lovin sits on the board of directors for the American Association of Family Physicians and opened her own DPC in 2020.
And I just really feel like a better relationship builds from that.
For unlimited doctor visits, annual exams, flu tests, urgent care, x-rays, and more, patients pay a flat monthly fee, much like a subscription service.
It's kind of like Netflix. We talk about that as another kind of subscription-based. You can watch as many shows as you want, or you can watch no shows.
What sets direct primary care apart from other healthcare models is that it does not accept insurance, and patients don't have a copay.
I have a monthly fee. You know what that is. You know what it's going to be for the year.
Dr. Lovin says many of her patients have a high deductible through their insurance, and some have no insurance.
It's not recommended anybody go without health insurance, but if you've got a high deductible plan and your individual deductible is $5,000, that's a lot of money to put forth to get any kind of health care.
She says she sees patients on Medicare and Medicaid, and membership fees range from $60 to $100 for an individual adult.
I have patients who are on Medicare who come to see me. I have patients who are on Medicaid who come to see me. So they find a way around even being on the lower income if it's a service that they feel valuable.
What's up, Mike? You got the hot chicken Philly, man?
At Palmetto Proactive, some business owners like Kenneth Cribb are now using this health plan as an option for their workers.
But the face time that you get to spend with your physicians is just unprecedented. You don't feel like a sheep.
A 2024 survey by the American Academy of Family Physicians found about 2/3 of DPCs offer contracts through employers, and 1/4 customize their healthcare plans based on employer needs.
For employees, they're covered at the 50% level, so it costs them about $6.92 a paycheck.
The most common procedures in DPC practices are EKGs, suturing, and biopsy and excision.
We'll put in stitches if somebody needs stitches, they cut their finger, skin procedures if we need to take care of skin cancer. If we can handle it here, we'll do it.
But one of the most important, according to Dr. Lovins, is preventative care, like lab screenings.
There's a lot of insurance companies that don't like to pay as well for screening labs, looking for things that are going to help you in the long run. You have to find a reason to get a lab, basically. And because of the services that DPC can do with that reduced fee, they can get those screenings done at a much more reasonable price.
And ditching that traditional system, these doctors say, allows them to build a closer relationship for a healthier family.
Just really felt like it was what my calling was as a family physician.
Monthly membership fees for DPCs range from $20 to $49 for children and $50 to $100 for an individual adult.
For families with health insurance, there's another payment model called concierge medicine.
According to a network of hundreds of concierge medicine providers, it's similar to direct primary care, but concierge medicine does accept most insurance plans, including Medicare and Medicaid. Concierge medicine involves billing insurance for services, and members have a copay. On top of that, members pay a monthly flat fee for premium access to their doctor.